Hey dental fans, Dr. Rich here. In this video, I'm going to show you the instruments I use to extract a tooth. These are the most common ones that I use, and I'm going to kind of go over why I use the ones I do and the order I use them in. And to show you how I'm going to do it, I'm going to demonstrate on this plastic model of teeth. This one's a little different in that the teeth are actually attached with little rubber bands to the plastic jaw. So to kind of simulate kind of more like a real tooth. It even has molars, even have multiple roots. Okay, so won't be any blood on this, so you can watch without getting squeamish. And here we go. So the first assumption, let's assume, already numbed up the person, so you don't have to worry about that. So the first instrument I used is an instrument called a spoon excavator. This is actually an instrument that's used occasionally when it's designed more for cleaning out cavities. After you drill through the enamel, if there's any soft kind of mushy stuff inside the tooth, you can just scoop it out with this. What I do with this is I'll take it and I'll just push down between the tooth and the gum all the way around the tooth that I'm going to be extracting. I do this mostly first, I tell the patient that I'm doing this to check to make sure that the tooth and the gums are numb. So the person, while I'm doing this, the person shouldn't feel any pain. They may feel, or probably will feel, some pressure, and that's it. But also, while I'm doing this, I'm actually starting to separate the gums away from the tooth. So I'll actually push this in as far as I can, usually about 2-3 millimeters down, and that starts the process of extracting the tooth. All right, so the next instrument I use, two different ones. One's one is called a spade proximator. It's called a spade because it's got kind of like a little pointy tip, like a little shovel. And the other instrument is a Luxator. And both of them have very fine points on them. The tips of them are very thin and very narrow. So again, they work in a very similar way. And so teeth are attached to the jawbone with little ligaments. The ligaments are called the periodontal ligament. And so with these instruments, they're very thin. I'll use these to kind of get the instrument in between the tooth and the gum, and I just kind of press gently in. Sometimes I'll wiggle it back and forth, and I'll just work my way all the way around the tooth. So I'm doing two different things here. By pressing down, I'm starting to cut the periodontal ligament that holds the tooth into the jawbone, and I'm also, by pushing the instrument in between the tooth and the bone, it's expanding the bone a little bit. The actual hole, the part of the bone that holds the tooth in, when I press it, it'll actually open up a little bit. You can see it here with my fingers. If originally it's holding the tooth in tightly, but by pushing the instrument in, it expands a little bit and makes the hole bigger. That just makes it easier to get the tooth out. So I'll do that all the way around, try to get it down as far as I can. And I'll actually, in a lot of situations, especially if it's just like say a broken off tooth where there's just the root that's left, just by doing this is enough to remove the tooth. And especially for a front tooth, which only has one root, you can work this all the way around, and a lot of times that's the one instrument that I need, and basically you just kind of work, push, and as you can see, the tooth kind of pops up and out of the socket, and once that happens, it's loose enough. Sometimes you can just grab it with your fingers, pull it out all the way, or a pair of forceps. On molar teeth, though, usually that's just the start of loosening it up, and by doing that, cutting the ligament and opening the space up in the bone, that gives me some more room to use the next instrument, which is a straight elevator. So the first one that I usually grab is called a 301. That's just the size of it. This is one of the smaller ones. So it's a similar shape to the Luxator, except instead of it having a really fine tapered point, it's a little blunter on the end, but the instrument itself, it's a lot stronger and heavier duty. You can use a lot more force with this. So again, I'll use it in that same way, try to push it down in between, but I'm also going to start twisting it a little bit, side to side, to get it down in between there, try to get the tooth, and I'll even twist, try to work itself further down in there to, again, try to pop the tooth up and to expand the bone and to cut the ligaments. And this is strong enough that I will actually even, I can even, by twisting it, if I put it in between, I can twist it and it'll use the leverage of the instrument against the jawbone to try to push the tooth up and out. Now with this though, twisting it, you got to be real careful. You don't want to put any pressure on the tooth next to the tooth you're pulling, unless you're pulling that tooth as well. Because if you just go in there and twist away, you can damage the tooth that you're trying to keep. So you have to be very careful as to how you're directing the forces. You only want to push against the tooth and between the tooth and the jawbone, and you can use the jawbone as a fulcrum, so you got to be careful to do that. And again, once I get the tooth moving quite a bit, a lot of times you can actually get the tooth out with just this instrument. But the key is to try to get it moving as much as you can. The more you get the tooth moving, the easier it is. That's how it's going to come out. If I can't get the tooth out with this, then the last instrument I'll grab is a forcep. Basically, this is the fancy dental pliers that we use to pull a tooth. So once I get the tooth moving, but I can't get the tooth out of the socket, I'll use this. So this is a lower forcep. It's got a little bit different shape than an upper forcep. But this one, you grab the tooth and you can just try to rotate it a tiny bit. You don't want to go too much, because if you go too much, you can snap a root off. And then you want to press it, towards the cheek, towards the tongue, and you keep working it until finally, there you go, it comes out. And you get the tooth out. And that's usually, those are my, the three instruments that I use majority of the time. Again, either the spade proximator or the Luxator to start with, then the 301 straight elevator, and then finally a type of forcep. Now there are other instruments I'll use as well, depending on the situation. So for a molar, lower molar such as this, as you can see, it's got those two roots. There's another type of forcep called the cowhorn, which is going to be a little bit different. So shape, it's got these two prongs on it, kind of look like the horns of a cow, versus the traditional forcep, which grabs. What the two prongs will do is you grab the tooth right at the gum line, force it down as far as you can, and then you squeeze. And what will happen is, by pressing down and squeezing, it forces those tips down under the gums a little bit, and it actually follows the shape of the tooth and tries to pop the tooth up. Ideally you want to get the forceps down far enough so that they go into the space where the two roots meet, into the furcation. And the action you use for that, once you get them in there, is you pump them, by squeeze them, pump the handle, and a few times, and then take the tooth and you push it towards the tongue, push it towards the cheek. Sometimes you'll do even like a little figure 8 motion until finally the tooth will pop out. These are nice to have for lower molars because of the shape. There are a ton of different other elevators with different shapes. Here's another one called a crane pick. This one's actually even a different version of the crane pick. This is the Dr. Murph Crane Pick that's used a lot for, I like using this one for upper molars, so pretend it's an upper molar. This one's nice because you can just kind of wedge it in between, and you can, because of how it's shaped, you can kind of get it underneath that very last tooth, and just with a twisting motion, you can get that tooth out by pressing up against the jawbone up there, and the tooth will pop out. So that works very well. And then there's also tons of other designs for wisdom teeth. Have lots of different ones, have different angles, just so you can get into the back areas of the mouth a little bit easier. And then finally, my last thing that I use is the dental handpiece. It's a surgical handpiece, and that we can use to either cut the tooth in half, because as you can see, it's got two roots. Sometimes cutting it into half, and it's easier to remove one root, and then you remove the second root. So we can either do that, or we can even remove some of the jawbone from around the tooth to basically make the hole bigger so that the tooth comes out more easily. And you can just trough around it. Usually you just trough on the cheek side, and then you can make yourself some space till you get the elevator in there to get the root out. That works very well if the tooth's very broken down. Say it's a root canal tooth that cracked, or tooth's coming out in pieces and you're gonna have to go digging for it. But hopefully that gives you all an idea of the techniques and the instruments that I use to extract teeth. If you have any questions or comments, please leave them down below. Thank you guys so much for watching, and let me know, hey, how was your experience getting a tooth pulled? What'd your dentist use? Did they use the forceps mostly? Did they use the elevators? Did they use something else? Did they use proximators or luxators? Let me know in the comments down below. Thanks so much. Bye-bye.